these are all highly unreliable tests, but they're commonly used. And I think the key to any of these tests is make sure you're on the same spot on the PSIS like we talked about before. Okay, find the PSIS. So we'll do standing flexion first. March in place. March in place. Get your feet kind of equal. There's shoulder width apart a little bit. Stop, stop, stop. Okay, now find PSIS. Did I pull these things here? She's really got an asymmetry. And you could try to even out her feet. Her feet, well, actually, one foot's very pronated compared to the other one. But so what you're looking for is my fingers are at PSIS. You can even migrate them over to a little bit to be on the sacrum. And now I just want you to spin forward and back up. Okay, and so what you're theoretically looking for is one side. Which side is dysfunctional? You might say, right. So the side by dysfunctional, you'd say which side is hypomobile. So theoretically, the side where the sacrum and the pelvis are, the side that if it's stuck, they move together. So it's a real simple. Now there are a number of ways to say what is positive in this. There's a number of authors that say different things are positive. I was always taught the thumb that moves the furthest and the fastest and the fastest is the dysfunctional side. Are you with me? So what you're looking for is symmetrical movement of your thumbs, right? And the thumb, and if one of them goes real fast, what's supposed to happen is one of them goes real fast, then the other one catches up, and then they both go. But again, not real reliable. So the thumb that moves the furthest and the fastest is the one that's reliable. So that's standing flexion. Sitting flexion, a lot of your patients can't even do this one really well, unless they're athletes. So it's exactly the same thing. Now, what are the basic principles of looking for symmetry? We want to make sure our eyes are fairly eye level. You notice that when I'm here, I'm eye level. When I'm down here, I'm going to try to be eye level. Okay, because I'm looking for symmetry. How can I find symmetry if I'm not doing the same thing? Okay, I want you to spread your feet apart a little bit. There you go. Now the key here is flexion should be midline. Just like in standing, you try to get midline. Sometimes patients will go over and they can't really flex midline. But in standing, in sitting, you can get them to do midline by just doing this. So I want you to do this. Just kind of, not yet, not yet. Let me get back. So what I'm going to do is exactly the same thing. By the way, you're a little more symmetrical in sitting. Okay, go ahead. And this one moved. So they're exactly the same thing. You're looking for up and out, and you'll get that. Okay? Again, not real reliable. And I think one of the reasons they're not reliable is if we're not real good with our palpation skills. But they're not, you're not provoking pain, you're not positive for pain, you're positive for some kind of asymmetrical movement. The third one is called Gillet, and or also called a stork test. Has nothing to do with pregnancy, although a lot of people who have pregnancies have SI dysfunction. I want you to face that way again, and we'll kind of make this here where you can put your hand there if you want to. I don't really want you to, but if you want to. And again, so we're going to do exactly the same thing, PSISs, but I'm looking for down and out because I'm going to ask her to lift her leg up. Okay? And normally what I would do, the book shows actually this girl just like doing it in, without putting her hand on anything. On your patients, you might want to have something there for your patients. I usually have them do the inside. Some people have said do the inside leg only, and we'll just do them both just for. So once again, same place. Okay, now just lift your left leg up. Okay, put your hand on the thing. Now lift up further. Okay, now down. Now lift the other one up. Okay, not a lot of movement. So standing flexion. Now Gillet, I believe the book talks about putting your thumb now on the ILA and see if there's equal movement. I've never done that. So if anyone here has ever done that, the book talks about that. So that's standing flexion, sitting flexion, Gillet. thumb's on the PSIS, and you're just basically looking for symmetrical movement. And what you're trying to decide is if left SI dysfunction or right SI dysfunction. And what by SI, it could be IS or SI. In other words, let's say your findings are you've got an anterior torsion on the left or a posterior torsion of an innominate on the right, and you don't know which one it is, which, by the way, it's really not that important because you can treat them both at the same time, but you don't know which one it is, and so you might do this just to determine which one it is. Sometimes pain tells you that also, right? Reported pain. If it hurts on one side versus the other, get that if you chase the pain. Usually I don't use these anymore. I used them for a long time. I don't use them now because I just use techniques that treat both sides at the same time. And then see what happens.